Hi, I'm Dr. Ben Cilento, and I'm the owner of Texas Sinus and Snoring. Snoring is a common problem. Most people will snore on occasion, but some end up snoring quite frequently. This can cause problems that many people joke about, but can greatly impact a person's life. One misconception that many people have is that snoring is the same as sleep apnea. This is not the case. Resistance to the flow of air through your upper airways is on a continuum. It starts out as noise, or snoring, and ends up with varying degrees of airway obstruction or sleep apnea. About 40% of Americans snore, but only 10% of those qualify as having sleep apnea. Sleep apnea is when the airway periodically closes off and air cannot pass when you're sleeping. For a more in-depth discussion on sleep apnea and the treatment options available, please watch our sleep apnea video on our YouTube channel. Snoring is when something narrows the airway, making the airway turbulent. Snoring does not have the same long-term effects like heart disease, hypertension that sleep apnea does. This does not mean that it's not important to address snoring, though. Here at Texas Sinus and Snoring, we understand that snoring is serious, and we treat it as such. Snoring is a complex problem because there are three main areas that can cause the narrowing of the airway, namely the nasal passages and sinuses, the soft palate, and the tongue base. It's important to find out which level is responsible for the turbulent airflow so that it can be addressed in the best way possible. We have state-of-the-art equipment and facilities to find out exactly where the airflow is the narrowest and can address that area specifically. We start with a comprehensive physical exam and history to determine if there are any obvious abnormalities that need further evaluation. Based on the exam, a CT scan is done in our facility to evaluate the anatomy specific to you and to further evaluate any abnormality that would explain your issue. First and foremost, it's important to have an open and properly functioning nasal airway to establish laminar airflow prior to entering the pharynx. Therefore, the nose is usually the first place we address if there are problems. The CT can tell us if there are any septal deviations, enlarged turbinates, including concha bullosi, bony spurs, or chronic sinus inflammation. The presence of obvious nasal or sinus problems must be corrected up front. Correcting a significant nasal or sinus problem may clear up snoring altogether, and then we're done. If snoring persists, a sleep study is then ordered. The sleep study is important to determine if the obstruction is severe enough to qualify as sleep apnea or is just snoring and a noise that we make. The key component of the sleep study that makes this distinction is something called the AHI, or Apnea-Hypopnea Index. It's essentially the number of times an hour that a person stops breathing and registers a drop in blood oxygen levels. If there are more than 5 of them an hour, it's considered to be sleep apnea and needs treatment. The initial treatment for all sleep apnea is something called continuous positive airway pressure, or CPAP. You've probably heard of it. A mask is placed over the nose and mouth, and a column of air is driven through the nose and is used to splint the mobile tissues at the back of the throat open during sleep. This is why it is so important to ensure that there's an open and functioning nasal airway before sending a patient for a sleep study. Treatment options available for sleep apnea are many and are addressed in our sleep apnea video. 5 or less per hour is considered normal. Therefore, the noise you're making is considered to be just snoring. Although there are good treatment options available for simple snoring, they are usually not covered by insurance because they're considered to be cosmetic. Here at Texas Sinus and Snoring, we provide simple, affordable solutions in our facility to help stop that snoring. Remember, snoring is a complex problem, and the solutions are complex. Here at Texas Sinus and Snoring, we start with the most effective, least invasive, and move from one area to the next, correcting problems in a methodical manner until the snoring and/or sleep apnea are gone. Many of the treatment options that we provide are minimally invasive and can be performed in our state-of-the-art office. We have a procedure suite in our office, making your experience smooth and simple. We do our best to minimize the time and the number of stops you need to make to get the best treatment available. I can't wait to customize a treatment plan for you.